whether it's making sure that small businesses can remain viable through this difficult time, whether it's so that families can take care of their loved ones, put food on the table. We will make sure that Canadians are able to hold through this difficult time. We don't know exactly how long this is going to take, whether it takes weeks or months, but we know that every step of the way, we will be there to support each other.
A stark message from the Prime Minister today, warning Canada could be facing this COVID-19 crisis for weeks or even months. I'm Vashi Kapelos. This is Power and Politics. As Justin Trudeau urged Canadians to stay home, Ontario and Alberta declared official states of emergency, and provinces across the country introduced new measures to limit the spread of the virus. Ottawa is promising economic action tomorrow to help workers who've been impacted by the outbreak. We're going to bring you the latest on all of that throughout the program tonight. But first, health officials are turning to Canadians to help prevent an exponential rise in cases, calling on people to self-isolate, work from home where possible, and not to gather in groups of more than 50 people. Does that advice go far enough, or should stronger restrictions be put in place? Patty Hajdu is the Minister of Health. She joins me now in studio, and I want to make sure our viewers know that you are at least a meter away from me at the other end of the table, because we know that we are supposed to be practicing social distance. Minister, thanks for coming in. I appreciate it.
Thanks for having me back.
I know it's a very busy time. Ontario and Alberta, as we said off the top there, have both declared states of emergency. Is that the right move at this time, and should other provinces follow suit?
Well, listen, it is within the jurisdiction of the province or territory to use the measures that they think they need to activate their various systems and their various approaches. We stand by to support the provinces and territories, as we've said all along, both from a health perspective, but also from other perspectives. And so we've been working very closely with the provinces and territories since early days in January, when we first started to notice this suspicious activity in Wuhan.
I know that it's provincial jurisdiction and it's their decision whether or not to announce it. I'll tell you why I'm asking. The number one question that I'm getting from people who are watching the coverage throughout the day is that they are confused about which rules to follow and where. Do you acknowledge that there is mixed messaging out there, depending on if you're getting your instructions from the city you live in versus the province you live in versus the federal government?
So the federal government works with the provinces and territories through a special committee that's chaired by Dr. Tam, and the provincial medical officers of health work together to try and have some standardization around the advice that we're giving to Canadians. But it may differ from jurisdiction to jurisdiction, and part of that is what people are seeing in their own communities. So if a particular public health officer is advising the provincial government or the local government that they should take stronger measures because they're either concerned about a particular vulnerable population or they are starting to see signs of potential community spread, then they obviously have the jurisdiction to make those recommendations beyond what has been discussed at this special committee. At the federal level, we sort of set a baseline standard based on the science that we have here in Canada in terms of our own general Canadian situation and epidemiology, along with the recommendations that come from the World Health Organization and the technical groups that work at the international level.
Given, though, all the information we're getting about how exponentially fast the cases could rise, is it worth the federal government, for example, outlining that baseline policy and directing Canadians, in a sense, this is what you're supposed to do, this is what bars are supposed to, how bars should be closed, restaurants should be closed, don't go out of your house unless you are working in this type of sector? It's so hard to, I think the number one thing, as I said, I keep getting is, well, I work in a bank that has 60 people. Should I go to work? It's not clear to them. Should there be some sort of federal directive?
So the federal directive that Dr. Tam has given and that I've reiterated a number of times is stay home if you can. To employers, make sure that you're looking at ways that your workers can work remotely. That isn't going to be possible for all people. So people who are in essential services provision, making sure that they are protected well, that they can practice social distancing in their workplaces. It's going to be really an all hands on deck Canadian response. Those kinds of messaging that we've been providing is the general Canadian advice. If you can, stay home. Don't go out to bars or restaurants or other social engagements if in fact you have an opportunity to not. And in terms of gatherings, we've recommended that people don't hold gatherings of 50 people or more. That advice may change as we see the situation change.
Is just recommending something, though, enough, I guess, is my question. Does there need to be something more solid, something that carries potentially penalties with it? Like, does the federal government need to be planning and basing those decisions and directives on worst case scenarios?
Well, we haven't seen any indication yet that provinces and territories are not taking their responsibility seriously, and at the local level, that the planning and the recommendations coming from local public health is not being done in a serious way. Look, all of the public health officials that are working together at all of the levels of government are working flat out to make sure that Canadians have information and advice that is appropriate with World Health Organization guidelines, federal guidelines, and then very specific to their own circumstances. So, you know, at this point, obviously, we respect jurisdictional authorities to have, you know, have the regulatory oversight of things like bars and restaurants and what should stay open and what shouldn't stay open. I will also say that provinces and territories have been very collaborative with us in telling us the additional measures that they're deciding to take or when they're going to take those. But we do have to respect that there are jurisdictional responsibilities and authorities. And at this point, the federal government that is there to provide leadership, access to science and the evidence, access to resources like the money that provinces and territories will need in order to take further measures.
So you don't think there's any mixed messages out there?
I think there is obviously room for confusion in a situation that evolves so rapidly, but there are really good sources of information that people can check too. Canada.ca/coronavirus, we have a 1-800 number. Provinces all have a 1-800 number and resources online. Local public health also has information. So look, there's not a dearth of information. In fact, there's a tremendous amount, and I would say that most of it lines up. What the key message that Canadians need to hear right now is this is the crunch time. This is the time where we all have to pull out the stops and try to limit our exposure to one another as much as possible, practice a good personal hygiene, practice social distancing, and really take that personal sacrifice seriously, because this is what's going to help us get through this.
When the Prime Minister says your government is looking at the Emergencies Act, in what instance would that apply? I know the Deputy Prime Minister said today it would be a last resort, but specifically, why might the federal government need to use it?
So there are gaps in legislation sometimes where, for example, you may need specific tools that are not covered in any federal legislation, and provinces and territories may not have specific tools either to address very specific situations. One situation, for example, might be if you're trying to contain travel between one province or another, or particular parts of a province. But we've seen no indication yet that provinces and territories are not willing to work collaboratively. The Prime Minister, of course, has said that all tools are on the table, and that should we ever have to take measures that protect Canadians' health and safety, we will. But I will stress that this would be something that we would do with provinces and territories. And as I said, we are in a space where provinces and territories are working incredibly quickly, incredibly collaboratively. Will there be sometimes duplication or overlap or some, steps that provinces take a little bit in advance of other provinces? Probably, because of the rapid movement of the situation. But there is no indication at this point that we would need to impose upon provinces and territories additional extreme legislation that would compel them to do things, because they are doing the things they need to do to protect their citizens.
On that example that you provided of traveling within Canada, is that something the federal government is advising against right now? Should Canadians not be traveling within this country?
No, at this point, domestic travel has not been advised to, cease. We will continue to monitor that situation with our partners, our provincial and territorial partners. Listen, at this point, I will remind Canadians, although our cases are increasing quickly, we have 440 identified cases in Canada. We know there's likely more, but we're not in a situation where we have to significantly curtail people's movements, nor do I hope we get there. And I think that is the point of the messaging from provinces and territories and local public health, that we can avoid any further curtailments of movement of people if we really work hard to try and adhere to public health advice.
Let me challenge you for a second on that, because in the same instance, your government is saying, don't go outside unless you have to, don't leave your home unless you have to, don't go to work unless it's essential that you be there. But now you're saying that it's not time to limit movement. Again, that's a bit confusing, right? If we're supposed to be staying inside, should we not also be limiting our travel even within this country?
Well, listen, there are a number of ways to travel that wouldn't expose you to other people. Let's not forget that this virus is transmitted through droplets. So it's close contact with other people. So there are many other ways that we can practice social distancing when we're traveling within our country. Obviously, if people are traveling in their vehicle, there are ways that they can protect themselves. There are ways that airlines are working hard to make sure that they can help ensure that social distancing. Less people are traveling, I will point out, in general. And at this point, we are following science and evidence to make the decisions that we're taking together, and we will continue to do that because it's really important, Vashi, that we obviously take the right precautions, but that we also ensure that we have a society that continues to function. This is a very critical time for all of us, and I want to compel all of us to remain, focused on the goal today, which is to limit our interpersonal contact, and there are many different ways that we can do that.
You just came from a cabinet meeting. In your press conference earlier today, a variety of various ministers spoke about, and they were asked about the U.S. border, the border with the U.S. Today we found out from Ontario officials 29% of travel-related cases in Ontario are now from the United States. I completely understand the integration of our economies and the vital nature of at least goods being able to pass between that border. Where are the discussions at when it comes to the border and the potential for at least closing it off in part?
My colleagues are talking right now with the United States administration, and those conversations are happening incredibly rapidly. On both sides of the border, there's a desire to curtail non-essential travel, and we'll have more to say about that at the conclusion of those conversations.
From a health perspective, as Minister of Health, do you think there needs to be some sort of curtailment at the border, given the statistic I just laid out?
I think Dr. Tam was very clear when she said that we should all cancel non-essential travel. And as I said to Canadian viewers earlier today, for people that live close to the border, we often think of ourselves as integrated in those border towns, and I come from a town that's very close to a U.S. border, but this would mean stopping, movement across the border to purchase gasoline or cigarettes or alcohol.
What about the other way around? People coming into this country.
And so,
should that be curtailed?
So yes, there's, as I said, conversations are happening right now to curtail non-essential travel.
And do you know when that announcement might be made?
I'm not in those conversations with the U.S. administration, but I know that people are having them as we speak.
Okay, I'll leave it there. Thanks a lot, Minister Hajdu. Appreciate you coming in today.
Thank you very much.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.